Adductor brevis lies posterior to adductor longus and anterior to adductor magnus. This has a broad, flat attachment onto the inferior ramus of the pubis, just below gracilis. Again, it's a triangular shaped muscle, passes downwards and laterally, attaching onto the upper half of the linea aspera and onto the lower part of the pectineal line. It is an adductor of the hip, and again, its nerve supply is the obturator nerve L2-3-4. Adductor magnus is the largest and most posterior of the adductor group. It has two heads, the ischial head and the adductor head, that are continuous with each other in their proximal attachment. The ischial head arises from the ischial tuberosity. It shares a common proximal attachment with the hamstring muscles. The adductor head arises from the ischial ramus or the ischiopubic ramus here. The two heads pass distally and laterally, and the muscle itself attaches to the whole length of the linea aspera and to the adductor tubercle and medial supracondylar ridge on the medial condyle of the femur. There is a gap between these two attachments. This is known as the adductor hiatus, and the role of the adductor hiatus is to allow the passage of a blood vessel from the anterior compartment. So as the femoral artery runs down, it passes through the adductor hiatus to enter the posterior compartment before becoming the popliteal artery. It is a powerful adductor of the hip, and the ischial head contributes to extension of the hip. The ischial head is sometimes known as the fourth hamstring. It has a dual nerve supply via the obturator nerve L2-3-4, and the ischial head is often supplied via the tibial nerve L4 and L5. Muscles producing abduction at the hip are the upper fibers of gluteus maximus, but more importantly, gluteus medius, gluteus minimus, and tensor fasciae lata. The muscles producing medial rotation at the hip are gluteus medius, minimus, and tensor fasciae lata again. Psoas major and iliacus may also assist with medial rotation, although there is some debate as to their role as medial rotators. The dual role of medius, minimus, and tensor fasciae lata is important during the weight-bearing phase of gait. All of these muscles arise from the gluteal surface or the lateral surface of the ilium, of the innominate bone. The primary role of gluteus maximus, as can be seen here, is as an extensor and was described earlier. When we take gluteus maximus out of the way, we can then see gluteus medius lying underneath it. Take gluteus medius out of the way and we can then see gluteus minimus. So these three muscles lie one on top of the other. Tensor fasciae lata, as described earlier, arises from the anterior part of the iliac crest and the anterior superior iliac spine, lying superficial, covering the anterior portion of gluteus minimus. It's the upper fibers of gluteus maximus that contribute to the movement of abduction. Here we can see the proximal attachment of the abductors. So over here we've got the posterior suprailiac spine. This is the anterior suprailiac spine. This brown area is the area where gluteus maximus arises from. Gluteus medius arises from the gluteal surface of the ilium between two lines, the posterior gluteal line over here and the anterior gluteal line over here. So it has a large fleshy attachment onto this surface of the innominate bone. Gluteus minimus, on the other hand, arises between the anterior gluteal line and the inferior gluteal line here. Again, on the lateral surface of the ilium, again a large fleshy attachment. Now both of these muscles pass laterally, so they pass out of the page towards you before inserting onto the top of the greater trochanter, on the upper lateral aspect of the greater trochanter. As we can see in this small diagram here, there is a small bursa that separates the tendons of gluteus medius in particular and gluteus minimus. This is known as the trochanteric bursa, and the function of this is to prevent friction between the greater trochanter and the deep surface of these muscles during the movements of flexion and extension. This is the attachment of tensor fascia lata. It's from the external surface of the iliac crest on the anterior portion. And again, this passes laterally, covering the anterior portion of gluteus minimus before inserting onto the iliotibial tract. All of these muscles act as abductors and medial rotators of the hip joint. It's possible that the posterior fibers of gluteus medius may also act as lateral rotators of the hip joint. Tensor fascia lata has a secondary role as a hip flexor. Functionally, as mentioned earlier, their most important role is during the weight-bearing phase of gait. As we plant our foot to the ground, these muscles will contract to prevent the opposite side of the pelvis from dropping down. Inadequacy of these muscles will lead to a gait pattern known as a Trendelenburg gait. A Trendelenburg gait can be observed in individuals that may have arthritic hips and consequently don't use these muscles effectively, or may have had hip surgery which has involved an incision through these muscles, so therefore these muscles become inhibited, and as they weight bear on one limb, the opposite side of the pelvis is seen to drop down. What they do to get the ground clearance of for the opposite limb during walking is they often lurch their trunk off towards the weight-bearing side. The nerve supply of the abductors and medial rotators is via the superior gluteal nerve roots L4, 5 and S1. Finally, deep to the abductors and deep to gluteus maximus, on the posterior aspect of the hip joint, we have a small group of muscles known as the lateral rotators. These include here piriformis, which is the largest of the lateral rotators, gemellus superior, obturator internis, gemellus inferior, this red one, and then quadratus femoris. And then deep to these, there is obturator externis. All of these muscles pass from pelvis towards the greater trochanter, and their function is to produce external rotation or lateral rotation of the hip joint. These are deep structures, and clinically the most significant point to note is the relationship of the sciatic nerve with these muscles. Here we can see there's piriformis, and down here we have gemellus superior. We can see an opening, a hole between these two muscles, and this is the hole through which the sciatic nerve passes. The greater sciatic notch is found on this side of the hole. So the sciatic nerve will pass from the inside of the pelvis, from internally through to the outside of the pelvis before passing down into the hamstring compartment. This relationship is important as overactivity from piriformis and or gemellus superior can lead to compression of the sciatic nerve, leading to sciatic pain or sciatica. This condition is often referred to as piriformis syndrome.